Hey folks, Dr. Walker from dentalwalker.com. Welcome back to the channel. Today I'll talk a little about vitamin D and vitamin D levels, where they should fall for most people. Before I get too far in this video, if you like what we're doing, what we're talking about, give me some likes, some thumbs up so I can continue doing this endeavor. I like what I'm doing, and I hope that you are getting some information from this as well. So let's get into it. So vitamin D levels. Now, a lot of folks will tell me that their doctor tells them that their levels are normal. Normal as defined by what, I don't know, right? So a lot of folks will tell you that, their D levels are 30 and 31, and that's fine, and which, it is technically fine, right? But driving your car on a quarter tank of gas is, to some people, also fine, not fine for me. I'd rather maximize my D levels best as I can, which means that I want those numbers to be upwards of 80 to 100 nanograms per milliliter. That's where I want my vitamin D levels to be because of the therapeutic effects that it offers at those levels, to include the big C, right? So I would do that. Now, but before you start taking your vitamin D, though, however, be certain to get your levels checked, right? You need to know where your levels are before you start. Now, once you know what they are and they're less than 80, right? Then you can begin your therapy. And some people would say you can start probably with 5,000 units. It sounds like a lot, 5,000 units, and then check your levels in about 3 months and kind of see where they are. And then you can begin to gauge where you need to be, how much you can change it to in 3 months, just to get your levels in that range, 80 to 100 nanograms per milliliter. Now, that's with D3 and K2. So K2 also, you can take, with each 5,000 units of D3, you can take about 100 micrograms of K2. Those two things work in concert, and those two things you should take in the morning. And in the morning, I say that because you do not want to take them at night, because if you take them at night, you run the risk of a little bit of insomnia. So take them in the morning, helps to energize some folks. Magnesium glycinate specifically, 400 milligrams for men and about 320 thereabouts for women. You take that at night or in the evening because it helps to relax you. And it's important to take it at night, around the same time every night, to keep the serum levels about the same. Now, vitamin D3, K2 are fat-soluble vitamins, as are vitamins A, E, and K, right? So when you're taking those, take them with a little bit of fat, a little bit of good fat, meaning some pistachios, some olive oil, some butter, right? All those things, and I talk about things all the time in terms of what good fats. Take them with some good fats in the morning. It helps the absorption a little bit. Curcumin is also one of those things that you should probably take with a little bit of fat. The magnesium you can take with water, again, at night around the same time, just to keep your levels, your serum levels, about the same. So again, check your levels before you start. You can start with, for most people, about 5,000 units of vitamin D3 and 100 micrograms of K2. Magnesium, I mentioned before, 400 milligrams for men, and for women about 320 milligrams RDA, right? So those are the minimum amounts that you should be or could be taking for keeping you out of the basic dangers, which is why I say maximize those levels, your D3 levels, vitamin D levels, up to 80 to 100 nanograms per milliliter. And again, it's really for all the additional benefits, right? Just basic things like viral infections and things like asthma and skin disorders and blood pressure issues and immune support, right? All of those things, having adequate vitamin D levels will help you with long term. Thanks for listening. Take care, Dr. Walker.